What's going on, everyone? Happy Wednesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you tested negative. If you did test positive, hopefully you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, October 18th, 2023. We were saying yesterday it was uncertain whether or not I would get a pandemic update out today or we would do the staffing shortages video, but turns out I was able to work out a little bit of time to get in a quick pandemic update today. Starting off, in Europe, back during the second wave of COVID, when COVID was still in its uncertain stages and its fairly new stages. There was the first wave, then there was the second wave. Well, in England, COVID-19. 167,000 people may have caught coronavirus in the hospital in England during the second wave, a study suggests. That's right. Researchers analyzed data from 356 hospitals looking at the number of COVID infections, the staff, days lost, and how the likely source of infection was classified. We don't need to read this whole thing. What this tells us is something that we already know. Hospital spread of COVID is real. Hospital spread of COVID, it's big. I mean, how many times do you go into a hospital and you do not see people wearing these N95s? I had a delivery this morning that went to Abington Memorial Hospital. I normally don't take hospital deliveries because it's risky, but I accepted it. I didn't realize where it was going until after the fact. I was like, oh no. It was going to the entrance, and it was at the time of the morning when people are, starting their shifts. Shift change like around 7 a.m. Some people work 7 to 11 or whatever the shift may be, 7 to 3, maybe it's 7 to 7, I don't know. But I saw a lot of people coming in and start their shift. The majority did not have masks on. So while this study is for the UK, England, you know what? It goes to show if it's like that there, who knows how many there have been here in the United States. Remember, this study is just for the second wave, so not masking in healthcare. Yeah, it's easy to see why there are so many cases in healthcare. Now taking a look at this. COVID-19 outbreak prompts Northumberland Hills Hospital to postpone 20th anniversary events. Yep, you got it. Another COVID outbreak is postponing an event. It's something that we see happen quite often. North Carolina. Mpox cases reported in North Carolina. State health leaders urge people at higher risk to get vaccinated. If you recall, we did see back in September that there were a few Mpox cases detected in the wastewater. And it actually does mention this in some of these articles. I don't know whether it's in this one or not, but there's several different articles on this, and they actually mention, yes, it was detected at a wastewater site. Poland reports H5N1 bird flu outbreak among backyard poultry. So Poland is starting to see H5N1 go up again. The outbreak was found in backyard with 80 domestic birds. The Paris-based body said, quoting information from Poland's health authorities. So that's not good. Now let's take a look at air qualities. It's very important that we look at the air qualities every day because air qualities do impact our health. And I can tell you, though we're having good air quality here in Pennsylvania, southeast Pennsylvania this morning, or today I should say, I'll tell you what, my cough was off the charts this morning. So I don't know if that has anything to do with the air quality because take a look here. We don't have terrible air quality here. Slightly worse around the Great Lakes, and then taking a look, the worst places in the United States is definitely on the West Coast. Things continue to get worse in California. Now we're starting to see Arizona pick up. We're seeing Oregon. We're seeing a little bit of Washington. More so California. Wow. The mountainous region of California is just not good. Louisiana, no improvements down by New Orleans today. Still poor air qualities for you. Also Illinois and Indianapolis. I'm taking note of that now as well. So it's something we will have to keep an eye on. There is going to be a system that comes into the Northeast this weekend. We'll have to see if that impacts air qualities at all. Taking a look at heat-related illnesses, we're not terribly concerned with that. We know the Walgreens this week nationally is 26.2%. That is down 0.3% from last week. Prior week was 26.4%. Total tests, 11,656. And the prior week was 10,921. Moving on now we do want to take a look at a couple wastewater scan sites, but believe it or not, we can look at the national level here on the wastewater scan dashboard. And the national level is in the medium level. It has been dropping. Most recent update, a little bit of an uptick, but I say uptick because that may smooth out on and get corrected via the next update. We'll have to see if it keeps dropping. The peak on the national level was on August 28th. So at the end of August, influenza, surprisingly, is still low and dropping. RSV is low and dropping. HMPV is not an issue. Nationally, Mpox also not an issue. And norovirus, it's continuing to be high. The most recent update shows a little bit of a drop, but the overall trajectory since late September is upward. I am concerned about norovirus, and I got a feeling I'm going to be in these updates, probably be talking about outbreaks soon. From time to time, I do type that in when I do my searches, and I got to remember to do that daily because with it, there are high levels of norovirus being detected in the wastewater. Chances are we're going to hear about some outbreaks. Let's take a look at a couple wastewater sites. We'll just do two today. How about we do this rural area of California? No, let's just do a random one in California. Here we go. Monterey wastewater facility. I believe this is what this is called. And you can see here, COVID is low here. Influenza, not an issue. RSV, not an issue. HMPV, rising. No Mpox detected. And norovirus at this time. Wow. Norovirus here is actually rapidly declining. So that's good to see. And should we stay with the West Coast? Should we go east? How about we come up here to Idaho? We have not given any attention to Boise, Idaho in a while. What's going on there? COVID looks like it's high, and wow. You would think this is just one update, but it's not. Multiple updates now show a rapid increase in Boise, Idaho. This shows something that I've been stressing daily. Just because nationwide we have peaked from the summer surge and dropping, it could be very different in your community. This is a community of 108,556 people at this wastewater site. And you can see here, it varies here. It's much different here than the national picture and maybe a different county in Idaho. So there it is rising. Influenza has dropped. RSV has dropped. No HMPV. Mpox is low and norovirus at this time. The overall trajectory is upward despite that we did see a slight decrease on the last update. Alright, continuing on now because we are pressed for time today. Taking a look at the latest variants, EG.5, 23.6%, HV.1 is at 19.5%, FL151 is at 13.5%, XBB116.6 is 10.3%, and HK.3 is at 4.9%. Taking a look now at COVID-19 hospital admissions. In the past week, 16,766. Taking a look at New Jersey for today, 572 people in the hospital. That is down slightly from the previous update. 27 people on a ventilator, 69 people in the ICU. Discharges, 110. That's a lot of discharges. That's a good thing. And 69 out of 70 hospitals reporting. That's good, but we would like to see 70 out of 70. Taking a look at EMS incidents in southeast Pennsylvania, specifically Philadelphia County. 716 reported yesterday, so that's actually really great. I thought for sure there would be an increase last night with all those events going on, but no, it's not, so that's good. We're finally seeing lower levels of ambulance calls in Philadelphia. I suspect around the holidays is when it will go up again. Now taking a live look at Montgomery County. Currently there are 14 EMS calls at this time. I'm seeing one that is respiratory related. 14, while that may seem high, we have seen higher for this time of day. Taking a look at Chester County, Pennsylvania, which is just southwest of Montgomery County, I'm seeing 2 respiratory calls, multiple sick person calls. Yeah, busy and not good in Chester County. And who knows if any of them are COVID related. Taking a look now at New York State, 1,063 new cases today. Hospitalizations, they dropped again. This is a good thing. 1,409 people in the hospital. And taking a look at Chicago, most levels are in the green, which green means dropping. However, vaccinations is also in green. That means rising. The number of people getting vaccinated, 3,517 is the daily average. That number's up. And unfortunately, deaths, it says daily average is 0.71. That is up slightly from the previous update. And we do have new data out of Texas today. Not as big as a case drop this week. Current week, 9,531. Previous week was 9,753. That is down by 222. And then when we come down to fatalities, this is not good. This number's up, and we know that number tends to lag with a wave. 72 versus 64, that is 8 fatalities higher than the previous update. Number of people in the hospital, 998. So that is down 72 from the last report, which was 1,070. Taking a look now, let's see. We do have low levels of influenza, COVID, and hospitalizations for COVID in Massachusetts at this time. But remember, that goes by the old CDC guidelines. 10.4% of all emergency department visits in the last week were for respiratory issues. Let's briefly take a look at a couple international numbers. And you can see here, Germany, cases now up 21%, deaths now up 37%, 145 versus 106. Canada, cases up 28%, deaths are up 34% now. So that's 195 deaths versus 145 deaths. That's not good, and there has been an increase in the UK. So perhaps Canada is following the UK. Brazil reports deaths are down 60%, cases are down 26%. Italy, cases down 84%, deaths down 83%. Bulgaria, cases up 11%, deaths down 39%. Switzerland, cases up 21%, no deaths reported. And we'll end today on Poland, where cases are up 26% with a 200% increase in deaths, but that's because 3 versus 1 equals 200%. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update, I think, again tomorrow with some more states that will update. I will see you all again next time. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And if you know anyone that needs to see these videos, by all means, share this with them. Thank you for watching, and I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a great Wednesday afternoon.